Cefixime, a third-generation cephalosporin antibiotic. Like every antibiotic, it's not risk-free. Today, we're diving deep into its adverse reactions, contraindications, and important precautions, all based on clinical data and post-marketing reports. Let's start with the more common adverse reactions, the ones seen in more than 10% of patients. Most of these involve the gastrointestinal system, meaning your stomach and intestines. Around 30% of patients may experience GI symptoms. These include abdominal pain, diarrhea, dyspepsia, which means indigestion, flatulence or gas, frequent bowel movements or loose stools, nausea and vomiting. While these aren't usually dangerous, they can be uncomfortable and sometimes limit compliance. Once a drug hits the market, new side effects can emerge, and Cefixime is no exception. Let's explore these post-marketing reports, the ones identified after the drug was widely prescribed. Dermatologic reactions are particularly important. Acute generalized exanthematous pustulosis, which is a severe rash with pus-filled blisters. Bullous pemphigoid, an autoimmune blistering disorder. Erythema multiforme, fixed drug eruptions, and even life-threatening reactions like Stevens-Johnson syndrome and toxic epidermal necrolysis. These are rare but serious, requiring immediate discontinuation of the drug and medical support. Other systems can be affected too. Here is the list. Which system do you think is most commonly affected by antibiotics overall? The gut, the skin, or the liver? Now, when should it not be used at all? It's contraindicated in patients who have hypersensitivity, meaning allergic reactions to Cefixime itself, other cephalosporins, or any component of the formulation, because cross-reactivity between beta-lactam antibiotics like penicillins and cephalosporins can cause severe allergic reactions, including anaphylaxis, which is a life-threatening emergency. Now, let's talk about the precautions, situations that require extra care. Severe cutaneous reactions have been reported. If a reaction occurs, stop Cefixime immediately and start supportive therapy. Cefixime can rarely cause immune-mediated hemolytic anemia, where the immune system destroys red blood cells. Patients should be monitored for anemia signs, like fatigue, pale skin, or jaundice, even 2 to 3 weeks after therapy. If hemolytic anemia occurs during therapy, discontinue use. Since Cefixime is a beta-lactam antibiotic, allergic reactions can happen, especially in those sensitive to penicillin or other cephalosporins. Always discontinue the drug if an allergic reaction occurs. Cefixime can cause acute renal failure, often linked to inflammation of kidney tissue, tubulointerstitial nephritis. If kidney function worsens, stop the drug and manage supportively. Prolonged use can lead to superinfection, growth of resistant bacteria or fungi. One key concern is Clostridioides difficile-associated diarrhea, which may appear even months later. In renal-impaired patients, dose adjustment is crucial to avoid drug accumulation and seizures. Use with caution in patients with prior gastrointestinal disorders. Do not administer to patients with a history of cephalosporin-associated hemolytic anemia. Recurrence of hemolysis is more severe. Some formulations have additives that require special attention. Benzyl alcohol or benzoate. This can cause a potentially fatal condition in neonates known as gasping syndrome, marked by respiratory distress, metabolic acidosis, and collapse. Avoid in newborns whenever possible. Another additive is phenylalanine, usually found in chewable tablets. It should be avoided or used cautiously in patients with phenylketonuria, a metabolic disorder where the body can't break down phenylalanine. And that's the complete safety profile of Cefixime, from common side effects to rare and serious warnings. If you found this helpful, hit that subscribe button for more clear, clinical pharmacology videos.